Revisional bariatric surgery. Revisional bariatric surgery. A surgery to repair or change a previous weight loss surgery. It is often more complex and has a higher risk for complications than an initial bariatric procedure. Indications: less than optimal weight loss or weight regain, complications from the original procedure, adjustable gastric band, e.g. device-related infections, band slippage, ulceration, erosive gastritis due to band erosion, and impaired gastric emptying, productive burping, regurgitation, internal bleeding, hiatal hernia, gastric sleeve, e.g. reflux, dysphagia, leakage and or bleeding in the staple line, gastric pouch stenosis, hiatal hernia, wound infection, gastric bypass, e.g. bowel obstruction, dumping syndrome, gallstones, internal hernia, protrusion of abdominal viscera, most commonly small bowel loops, hypoglycemia, ulceration. Examples: repairing a hiatal hernia or internal hernia. In adjustable gastric band revision, band replacement. In gastric sleeve revision, resolving adhesions, releasing scar tissue, and re-sleeving, making the gastric pouch even smaller. Conversion from adjustable gastric band revision to gastric sleeve or Roux-en-Y gastric bypass, significantly greater weight loss but higher rates of reoperation and readmission than gastric sleeve. Another bariatric surgery for converting to Roux-en-Y gastric bypass, mini gastric bypass, or duodenal switch.